What causes watery eyes when you have dry eye? Imagine feeling like your eyes are dry and irritated but still watering constantly. That's a common experience for many people with dry syndrome. It might seem confusing because dryness and watering seem like opposites, but there's a clear explanation rooted in how our eyes respond to irritation. Dry eye syndrome happens when the eyes don't produce enough tears or when the tears evaporate too quickly. This leads to discomfort, redness, and sometimes blurred vision. But the surprising part is that the eyes often produce excess tears in response, which causes watery eyes. To understand this, let's look at how tears work. Tears are made up of 3 layers: oil, water, and mucus. The oil layer, produced by tiny glands in the eyelids, prevents tears from evaporating too fast. The water layer keeps the eye moist, and the mucus helps spread the tears evenly across the eye surface. When any of these layers are out of balance, the eye can become dry and irritated. In dry eye syndrome, the problem isn't always just a lack of tears. Sometimes the oil glands don't work properly, causing tears to evaporate quickly. This leaves the eye surface dry and irritated. In response, the eye's natural defense kicks in: reflex tearing. The tear-producing glands, called lacrimal glands, start producing more tears to soothe the irritation. But these reflex tears are different from normal tears. They lack enough oil and other components needed to properly lubricate the eye. Because of this, they tend to spill over, making your eyes look watery even though they are actually dry. This cycle can be frustrating. You feel dryness and irritation, so your body produces more tears, but these tears don't fix the dryness. Instead, they just overflow, causing tears to run down your face and sometimes blurring your vision. You might find yourself wiping your eyes constantly, which can be annoying and uncomfortable. Several factors can contribute to this condition. As people age, especially women, hormonal changes can affect tear production. Medications like antihistamines or blood pressure drugs can also dry out the eyes. Environmental factors like wind, dry air, or prolonged screen time can worsen symptoms. Wearing contact lenses or having underlying health issues such as autoimmune diseases can also play a role. It's important to remember that watery eyes can also be caused by allergies, infections, or blocked tear ducts, so seeing an eye care professional for an accurate diagnosis is essential. While dry eye is a separate condition from diseases like glaucoma or macular degeneration, it can coexist with them. Some treatments for glaucoma, for example, can cause dry eye symptoms. Managing dry properly is important for overall comfort and health, especially if you have other conditions. Treatments aim to restore the proper balance and quality of tears. Artificial tears or lubricating drops are common options. Lifestyle changes, like taking breaks from screens, using humidifiers, or avoiding windy environments can help. In some cases, doctors may recommend procedures to improve tear production or retention. Every person is different, so personalized advice from an eye care professional is the best way to find relief. In summary, watery eyes in dry eye syndrome happen because the eyes try to compensate for dryness by producing extra tears. These tears are often poor quality and don't resolve the underlying problem, which is why symptoms persist. Proper diagnosis and tailored treatment can help break this cycle, making your eyes more comfortable. If you experience dry or watery eyes, especially if you have other eye conditions like glaucoma or macular degeneration, always consult an eye care professional for guidance.